Here we are presented with a dorsopalmar view of both hands. The key feature that jumps out immediately is the subperiosteal bone resorption, which is classically associated with hyperparathyroidism. It's most prominent along the radial side of the middle phalanx of the middle finger on the right hand, but there's also similar resorption along the ulnar aspect of the middle phalanx in the left hand, particularly at the distal diaphysis of the middle finger. What really catches my attention, though, is the well-defined lucent lesion within the proximal phalanx of the left index finger. This lesion has the typical appearance of what's called a brown tumor, which is a characteristic finding in hyperparathyroidism. The bone density overall looks quite normal otherwise, and I don't see any fractures or signs of significant osteopenia here, which is reassuring, but we can't ignore the pathology present. Given these findings, I'd confidently lean towards hyperparathyroidism, likely with a secondary brown tumor in the proximal phalanx. Now, this type of bone resorption, especially in the context of a brown tumor, would prompt me to recommend further investigation to evaluate parathyroid function and check serum calcium, phosphate, and PTH levels. Additionally, I'd look into renal function, since chronic renal failure can also contribute to secondary hyperparathyroidism. For the examiners, they might ask about differential diagnoses for bone resorption. So I'd be ready to discuss other conditions that could present with similar findings, such as renal osteodystrophy or osteomalacia, though the pattern of subperiosteal resorption strongly points to hyperparathyroidism in this case. They could also ask about the management approach. Here, I'd suggest further lab investigations to confirm hyperparathyroidism, and then, depending on the type, primary, secondary, or tertiary, management could involve surgical removal of a parathyroid adenoma if it's primary, or addressing the underlying cause in secondary cases, such as improving renal function or managing chronic kidney disease. Finally, don't forget to subscribe to my channel, Radiology Made Easy, for more insightful breakdowns like this one, and leave a comment below if you've come across a similar case. Let's keep learning together. Now, let's move on to the next case.